I'll look at the nerve system associated issue, and this is what we call the drop wrist of a patient. You can see the patient's drop wrist is still the same thing. Okay, and usually occurs when there's issues with the radial nerve. Okay, wrist drop. Okay, some people call it drop wrist drop, still the same thing. So what is it? Why does it happen? We say that the radial nerve usually supplies the extensor muscles of the wrist and the fingers. Okay, so when the nerve is injured, okay, commonly at the mid shaft of the humerus, this is when it is now rounding, okay, the humerus. Okay, we have spoken about the anatomy. Okay, we've spoken a lot about that anatomy. So you usually have those issues coming in. I'm coming. Okay, so that's what we got. What are the clinical features? So you are losing all those extension, your ability to extend. Okay, so everything is just dropping like that. Lots of finger extension, and if you want to grab things, it's usually weak. Okay, so weak grip. So sensory deficit, you are not able to feel over the back of the hand. Okay, and this is where the radial nerve supplies sensation. So reflexes, you are losing your triceps reflex, and also the brachial radialis reflex. So common causes could be due to fractures of the humerus. Now, because the radial nerve kind of like winds around the humerus up here, okay, it could be fractured, or maybe there's a compression here, okay, where the radial nerve is compressed. Also compression injuries, okay, like we're talking about, they call it the Saturday Night Palsy. We'll get to talk about that in depth. Then also injuries that are kind of like linked to medical procedures. Okay, so management immediate, you just have to splint the place to support the wrist. You can now do all those medical physical therapies, nerve stimulation, pain management. Then sometimes you have to do some surgeries to now repair the nerve or the tendon.